Good evening. Today we are going to concentrate on the women's health in general, talking about different subjects. Probably if we're going to talk about prevention, treatment, all of the aspects taking care of women's health, it's going to take too many episodes, and we're going to try to cover more than one if we can in this one. Women health problems are many, and one of the top one is heart disease and stroke. This condition is responsible for about 29% of death in women. Believe it or not, most of these women die at young age, in the 60s, because they are not identified as a typical heart patients. They comes in with too many symptoms, unidentifiable and non-typical. Some of it, for example, these women comes being out of breath, having some chest discomfort, some back pain, some toothache, some headache. The most important thing that to talk to your doctors about your symptoms and try to identify the reasoning behind it, because you could be one of those patients, and it's so important to identify you at the right time, at the right age, to avoid you from having more complication and more problems.
It started out like a totally normal day. Okay, move objection deadline to the third line after survey. What are you doing down there? Did you finish your breakfast? Ow. Whew. Don't hit your brother. I mean, you have to eat something. Here. Where's my coffee?
You okay, Mom?
Oh, I'm fine.
Sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah. Here.
Acai, my favorite. See you guys later.
We're going in 3 minutes. Oh, my God, what am I doing? I forgot to cut off the crust. Voila. Honey, get your sister. Okay, here. You sure? Nobody move. I'm getting a dustpan.
Whoa. Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? I'm just gonna sit down. Come on, Mrs. Underdog is not gonna wait. Whoa. 9, 1, 1. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Turns out I was having a heart attack. Heart disease is the #1 killer of American women. Make it your mission to save your life and the lives of the women you love. Find out more from the American Heart Association at goredforwomen.org.
The American Heart Association lists risk factors for heart disease as follows. Age. The older we get, the higher the risk for having heart problems. Male sex are considered higher risk. On the other hand, female sex is considered higher risk for dying from heart disease. Hereditary or genetic factors is considered a major risk factor also in having heart problems. Minority groups and ethnicity groups, including Hispanic and Native American, are considered at higher risk for having heart problems. Smoking, high blood pressure, high cholesterol, blood sugar or diabetes, obesity and overweight, all of those are considered also major risk factor for heart problems.
More people die of heart and circulatory disease than any other illness, and it remains the most common cause of premature death. In addition to those who die, the number of people managing the disease in their day-to-day lives is also increasing.
It's what causes angina and heart attacks, so most people would recognise it as that. And it's caused by a build-up of fatty deposits in the coronary arteries. And what these do, they either reduce the blood flow to the heart muscle, and that causes angina, or on occasions the whole blood vessel can get blocked with a clot, and that will cause a heart attack, which is clearly a serious event and is associated with significant mortality.
There never seems to be enough time to work, play and be healthy. Despite this, we do all have a choice about the lifestyle we choose to lead and the level of risk these choices place on our heart.
I think I could take a guess. Amount of exercise taken, whether you smoke or not.
Well, mainly your diet.
Lack of exercise.
Smoking, drinking, late nights.
Bad living in general, I reckon. Overeating.
Obesity, I would have thought.
Stress, I had no idea, no.
Smoking and drinking and stuff like that.
High cholesterol, lots of fatty foods.
Exercise, it's very important. That's about it, really.
In actual fact, there are 7 main risk factors that are said to contribute to coronary heart disease. Smoking, high blood pressure, high cholesterol, physical inactivity, being overweight, having diabetes, and family history.
We assess the risk factors together as a cluster of risk factors because we think these risk factors interact. So, for instance, if you've got someone with high blood pressure, they'll be at increased risk of heart disease, and someone who smokes will be too. But if you've got someone who smokes and has high blood pressure, their risk is multiplied that much more.
Heart disease prevention include the following. Don't smoke. It's so important to quit at the right time. Try to eat healthy. Try to treat your underlying medical problems, including the blood pressure, the cholesterol problem, and the blood sugar. Try to maintain a healthy weight. It's so important to have your ideal body weight based on your height and your age. And remember, the most important element is body mass index. We like to have the body mass index less than 25. It's acceptable less than 28. Try to limit your alcohol use. Even that many studies suggest drinking alcohol is good for the heart, we have to be careful because drinking too much could lead to some limitation and harm more than benefit. At the end, we have to mention that you need to manage your stress. Stress is considered a major risk factor leading to high blood pressure, high cholesterol, and diabetes lately, plus increasing your risk of having a heart disease. And the most important one, which I always talk about, is exercise. You need to exercise for at least 30 minutes during the weekdays, at least in a moderate intensity, as we're going to show during the next few segments. What about aspirin? Everybody is talking about should we or we shouldn't use the aspirin. In women specifically, there was a big study including 80,000 patients or women. That's called Nurses' Health Study. That study came with a major conclusion about the benefit of using a small dose of aspirin, which is baby aspirin, 81 milligram, or a moderate dose of 160 milligram. That study showed that women who took low or moderate dose of aspirin were 25% less likely to die of any cause, 38% less likely to die of heart disease or stroke, and 28% less likely to die of colon cancer.
To keep her heart healthy, this is Patricia Capsalis' daily routine. And so is this.
I take an aspirin every day for a year and a half.
The 76-year-old's cholesterol and blood pressure were getting high, putting her at a higher risk of heart attack. So she started a regimen of low-dose aspirin.
Well, I felt like it was certainly worth a try.
But a recent study shows of more than 200,000 women like Patricia who were recommended to take low-dose aspirin every day, less than 50% actually did.
It has a potential to reduce a first stroke by as much as 40%.
He says the drug, which can help prevent dangerous blood clots, is best as secondary prevention for those who've already had a heart attack or stroke.
The second major risk women face are cancers. Everyone probably hear about breast cancers, cervical cancers. At this point, the American Cancer Society lists the following risk factors for breast cancer and cervical cancer in general. Increasing in age, genetic or family history for previous breast cancer or cervical cancers, personal history of the disease itself, race, white women have a slightly greater risk of getting breast cancer compared to African American women. Yet, African American have a greater chance of dying from this disease because of delayed diagnosis. Earlier abnormal biopsies, earlier chest radiation for breast cancer, early onset of menstruation, or late menopause after age 55 also considered major risk factor for breast cancer and cervical cancer. Not having children, believe it or not, is one of the risk factors. Medication use, some medication could influence that risk to be increased. Too much alcohol could increase the risk of cancer in general. Obesity by itself could be a major risk. Remember, just because your mother did not have a breast cancer, it does not mean you are immune to this problem. Saying that, at the same time, it's important to remember that having more than one risk factor, it does not mean you're going to have cancer. Remember that your annual mammogram and preventive measure is so important to keep you one of those healthy people on the long run.
A mammogram uses low-dose X-rays to create an image of the breast tissue. It's able to detect lumps that are too small to be felt. MD Anderson recommends that women get annual mammograms beginning at age 40. Prior to menopause, you may want to schedule your mammogram for the week following your menstrual period, since your breasts may be less tender. Wear a two-piece outfit so you only have to remove your top. You will be given a gown to wear. You may want to schedule your mammogram early in the day since you cannot wear deodorant, powder, cream, or ointment on or in the chest area because they may show up on the X-ray as artifacts that may look like a breast problem. Also, bring the name, address, and phone number of the healthcare provider who referred you for the mammogram so the facility can arrange for the report to be sent to them. Your mammogram will be performed by a mammographer, a skilled radiologic technician in mammographic positioning and techniques. The test will be performed using a special X-ray machine that delivers low-dose X-rays to the breast and has special platforms or paddles used to compress the breast. This ensures a clear view of the breast tissue and reduces the amount of radiation needed to make an image. Your breast will be compressed for only 20 to 30 seconds. The entire mammogram procedure takes about 30 minutes. A radiologist will review your X-rays and send your referring healthcare provider a report of the findings. It is not uncommon for an initial mammogram to have suspicious findings since there are no previous mammograms that can be used for comparison. Most suspicious findings are benign and may be nothing more than cysts or spots of dense tissue. Occasionally, suspicious findings are the result of an unclear image. An additional mammogram to further evaluate a trouble spot is called a diagnostic mammogram and will focus on the problem area. In some cases, a breast ultrasound may also be recommended. You may want to schedule your mammogram during your birthday month. This is an easy way to remember this important annual screening exam and a great way to celebrate your good health.
Normally, I tell you to look at my face.
Not my chest.
But my face isn't what we're here to talk about.
This is what we're here to talk about.
About 1 in 8 women will develop breast cancer during her lifetime.
1 in 8.
And your risk of developing breast cancer increases as you age.
If you're 40 or older,
get a mammogram and clinical breast exam
every year.
The American Cancer Society
has played a role in nearly every major breast cancer research breakthrough in recent history.
and provides free services to breast cancer patients,
like rides to and from treatment and wigs during chemotherapy.
So what can you do in the fight to end breast cancer?
You can share this video.
Share this video.
Share this video, and let's make a world without breast cancer.
And more birthdays.
Over 2.9 million breast cancer survivors in the U.S. today
are living proof.
Living proof.
Living proof.
Living proof.
The third major health problem women could face is osteoporosis. This is a disease which threatens about 44 million Americans. 68% of them are women. Osteoporosis is largely preventable disease. The behavior that women can start or develop during their early life is the one which could prevent them from having osteoporosis at later stage in their life. That's because bodies build up most of the bone until age 30, then new bone stops forming, and the focus is on maintaining the old bone body mass.
The bones are important components which leverage and provide support to the human body. They are composed of calcium, phosphorus, and magnesium. Bones generally hold 99% of the body's calcium. Osteoporosis, or porous bone, is characterized by low bone mass and structural deterioration of bone tissue, which leads to bone fragility and increased susceptibility to fractures of the hip, spine, and wrist. Two essential cells are involved in the daily turnover of the bone: osteoblast cells and osteoclast cells. Overactivity of the osteoclast cells leads to osteoporosis. There are two types of osteoporosis: primary and secondary osteoporosis. Primary osteoporosis is in turn divided into type 1 and type 2. Symptoms of osteoporosis are swelling and joint pain, fracture, disfigurement and debilitation, and kyphosis. Osteoporosis can be diagnosed by bone densitometry, ultrasound, and by quantitative computed tomography. Osteoporosis can be treated by changes in lifestyle, like quitting smoking, regular exercise, a balanced diet, and by taking medications such as estrogen replacement therapy, biphosphonates, alendronate and risidronate, or synthetic calcitonin or parathyroid hormone supplements.
It's never too late to keep bones strong and avoid fractures. Your body will do what it can to repair bone damage, but you have to provide the tools for it, such as adequate calcium consumption and also weight reduction and physical activity. The risk factors for osteoporosis include your sex as a female is so important because we see osteoporosis more commonly in women. Increasing in age, small and thin bone frame, ethnicity, white women, white Asian women are considered at higher risk than African American, family history, and hormonal treatment which we use frequently for menopausal period. That's also considered a major risk factor. Some of the other rare factors which is considered contributing to osteoporosis include anorexia, the people who are trying to lose too much weight, diet which is low in calcium and vitamin D, medication use, also particularly steroid, could contribute to osteoporosis. Sedentary lifestyle, when we are just sitting, relaxing, doing nothing, continue to smoke, and excessive alcohol intake is considered a major risk factor for osteoporosis. You need to talk to your doctor again about your possible risk of osteoporosis and what you can do to prevent that problem. The next major elements we need to discuss in women's health is hormonal replacement. That therapy which we use it frequently for women postmenopause. Hormonal replacement therapy, which is we call it HRT, was widely recommended for the treatment of menopause and menopausal symptoms, as well as for the prevention of osteoporosis and heart disease in the past. A large study known as Women's Health Initiative shed a new light on how hormonal therapy is viewed. What are these hormones? It's a progesterone and estrogen, which is produced by women ovaries during their specific stage of their life. When it stops production, the deficiency in the body will lead to more symptoms of osteoporosis and the menopausal symptoms.
In America, 10 million people suffer from osteoporosis. There are grandparents, teachers, and friends, and yet many of us don't even know what osteoporosis is.
Osteoporosis is a disease that thins and weakens bones, making people more susceptible to fractures. To understand this condition, it helps to look at the role bones play in a healthy body. Bones are composed primarily of calcium. In fact, 99% of the calcium that's present in the body is found in bones. However, calcium is also necessary for other bodily functions, like blood vessel contractions. When sources in the blood run low, a normal process called resorption begins. Resorption steals calcium from bones to be recycled for use in other parts of the body. During resorption, scavenger cells with sawtooth membranes called osteoclasts attach to bone surfaces. There they tunnel into bone and regurgitate calcium into the bloodstream for use by other body parts. Resorption is complemented by a normal process called formation. During formation, construction cells, or osteoblasts, move into the tunnels left by osteoclasts and release strands of collagen into the holes, effectively filling them. Over time, the bone-breaking cells continue about their business while the bone-building cells slow down. The result is bones that are too weak to carry their load, increasing the risk of fractures. The most common form of the disease, primary osteoporosis, is a result of normal bodily changes like menopause or aging. Type 1 primary osteoporosis occurs in women in the several years prior to, during, and following menopause. During this time, decline of estrogen levels contribute to type 1 osteoporosis. Type 2 primary osteoporosis results from the normal, cumulative effects of aging. This gradual loss of bone density doesn't usually show up until after the age of 75. The other form of osteoporosis, secondary osteoporosis, results from certain prescription medications or medical conditions. Medical conditions like anorexia, alcoholism, and type 1 diabetes can all lead to the development of secondary osteoporosis. Meanwhile, medications like corticosteroids, thyroid hormones, and chemotherapy drugs also increase the risk of this disease.
What are the risks of taking hormonal treatment? While hormonal replacement helped many women get through menopausal period and by reducing their symptoms, we have to remember that it comes with quite few risks and it's not a simple treatment. It's well known at this point that the hormonal replacement could increase the risk of endometrial cancer or uterus cancer. Also, it will increase the risk of blood clots and stroke, especially in the people who has the risk factor for that, like smoking, diabetes, high blood pressure. Additionally, hormonal treatment increases the risk for breast cancer, especially when we use a combination of estrogen progestin together. According also to the Women's Health Initiative study, women taking estrogen progesterone combination therapy have an increased risk of heart disease. A later study suggested some abnormality or some minor changes in that idea, but we still believe that the risk of taking hormonal treatment for unnecessary reason is not ideal, and it's not appropriate to take the hormonal treatment unless it's so devastating your symptoms and you need the treatment only for symptomatic relief during your menopausal symptoms.
Well, the issue then is in women who are in the perimenopausal period, would there be any benefit, or is there an increase in cardiovascular risk when hormone therapy is initiated early? Well, for women at this point in time with known cardiovascular disease, unless their menopausal symptoms are intolerable, we would not recommend postmenopausal or perimenopausal hormone replacement therapy. The real role for postmenopausal hormone therapy is for the management of intolerable menopausal symptoms. And for those symptoms, there's nothing like hormone replacement therapy.
The National Institute of Health has the following recommendation for women who may have questions about the long-term use of hormonal treatment for postmenopause symptoms. First, the therapy should not be continued or started to prevent heart disease in specific. That's a very clear recommendation by the NIH. Second, prevention of osteoporosis. What they are suggesting that osteoporosis prevention by using hormonal treatment also is not ideal and should be individualized by discussing it with your family doctor. Third, women should keep up with their regular scheduled mammogram. Since hormonal treatment increases the risk of breast cancer, that's why you should have that test regularly in addition to the self-exam, which we always recommend for women. And finally, women taking the hormonal treatment for postmenopausal relief of symptoms, they have to remember to take the lowest dose possible and based on the best recommendation possible from your family doctor or your OBGYN. After talking about all of these women's health abnormalities, screening, discussion, we need to remember three things. The first one, we're trying to increase your awareness about all of these problems so you can take action. The second one, to discuss it with your family doctor and try to understand your specific individual risk because it's different from one individual to another. And the third element is to follow your doctor's instruction and to try to do your best to reduce your risk of having all of these problems by exercising, dieting, stop smoking, take care of yourself, and try to lose weight, and try to keep your body mass index less than 25 if you can. And the most important thing is to take your medication as your doctors recommend to you. Because remember, time waits for no one. You know, I always talk about having fun in your life. I believe that if you are passionately involved in positive things that give you joy, your health is directly affected. I have met such a group of ladies. They are Bride of Toledo Chorus and a member of Sweet Adelines International. This group of over 65 women sing 4 parts barbershop harmony. In November, these regional champions will compete on the international stage in Honolulu, Hawaii, with choruses from all over the world. During the upcoming month, we are to follow these groups' dynamic women, ranging in ages from 17 to 79 years young. The goal is to help these winners increase vitality and stamina so they are ready to be at their personal best when they perform for over 6,000 people in November. We call it One Heart in 4 Parts.